The rise of GLP-1 medications like Ozempic and Mounjaro has been nothing short of revolutionary in the weight loss world, offering rapid and often dramatic results. Yet, beneath the surface of these breakthrough treatments, there are emerging concerns that could complicate their widespread adoption. Recent studies have begun to point to serious, potentially long-term side effects that patients and healthcare providers may not have fully anticipated. One of the most alarming new developments involves the link between these medications and vision problems, which raises critical questions about their safety and the long-term consequences of their use. A review published in JAMA Ophthalmology uncovered at least 9 cases of patients who experienced vision loss after taking semaglutide, Ozempic, Wegovy, or tirzepatide, Mounjaro, Zepbound. These are not isolated incidents, but part of a troubling trend that is slowly emerging as more people use these drugs for weight loss and other off-label conditions. This report adds to a growing body of research that points to significant ocular risks, including a rare and potentially blinding condition called non-arteritic anterior ischemic optic neuropathy, NAION, which results from restricted blood flow to the optic nerve. NAION can cause sudden onset vision loss, and while these cases remain relatively rare, the fact that they are occurring with increasing frequency is enough to raise red flags. One of the main concerns is the rapid and sometimes drastic changes in blood sugar levels that these drugs can cause. Semaglutide and tirzepatide are designed to help control blood sugar by mimicking a hormone that helps regulate appetite and digestion. In doing so, they can lower blood sugar levels quickly, which, while beneficial for managing diabetes, might also trigger unforeseen complications in other areas, such as the eyes. The theory is that these rapid fluctuations in blood sugar may disrupt blood flow to sensitive tissues like the optic nerve, potentially leading to vision problems. However, researchers have yet to confirm a direct causal link between the drugs and the eye conditions reported, and they continue to explore this hypothesis. It's important to note that the patients affected by these vision problems were already dealing with a range of other health issues, including diabetes, obesity, and cardiovascular conditions, many of which are known to contribute to vision complications on their own. However, the fact that these vision issues seem to be cropping up more frequently in patients on GLP-1s indicates that these drugs may be playing a role, either by exacerbating pre-existing conditions or introducing new risks. The unknowns surrounding these drugs are becoming more evident as their use skyrockets. Despite the manufacturer's reassurances, the concerns persist. Novo Nordisk, the company behind Ozempic and Wegovy, has claimed that their research does not show a direct link between these drugs and NAION. But with the growing number of anecdotal reports and case studies suggesting otherwise, skepticism remains. It's crucial for patients using these medications to remain vigilant and consult healthcare professionals if they experience any vision changes. But even that advice does little to allay the underlying fears about these drugs' long-term safety. In addition to the potential for vision loss, users of GLP-1 medications have reported a host of other troubling side effects. Gastrointestinal issues like nausea, vomiting, and diarrhea are some of the most common complaints, but more concerning side effects like erectile dysfunction, mood changes, and increased reckless behavior have also surfaced. There's even talk of a new phenomenon, the Ozempic butt, where users experience sagging or loss of muscle tone in areas where fat was previously stored. These cosmetic changes, while less serious than vision loss, could have lasting psychological effects for users who place significant value on their appearance. What's perhaps most troubling is the growing trend of GLP-1 drugs being used off-label for weight loss, even by individuals who don't have diabetes or other obesity-related conditions. A 2024 study revealed that 12% of the U.S. population has used a GLP-1 drug at some point, with 6% actively using them today. The massive surge in demand for these medications, fueled by social media buzz and promises of effortless weight loss, raises questions about their safety when used outside of a clinical setting. Moreover, these drugs come with a hefty price tag, making them inaccessible to many and placing additional strain on healthcare systems. And while some doctors may view them as a quick solution to the obesity epidemic, the long-term implications especially when it comes to conditions like vision loss, nerve damage, and other unforeseen complications remain unclear. Until further research is done, patients may be unwittingly taking significant risks to achieve weight loss goals that could be met through less invasive, safer means. Even as these drugs are marketed as miracle treatments for obesity and diabetes, the excitement surrounding them should be tempered with caution. The potential for serious side effects, ranging from vision loss to gastrointestinal distress to long-term impacts on mental health, cannot be ignored. And as scientists continue to investigate their broader impacts, we may find that the cost of these medications goes far beyond the price tag, with health consequences that linger long after the pounds are shed. In conclusion, while GLP-1 medications like Ozempic and Mounjaro offer a promising solution to weight loss and obesity management, their use comes with significant risks. Vision problems, among other side effects, are emerging as troubling complications, and the growing popularity of these drugs makes it all the more urgent to fully understand their long-term effects. As research continues, it is essential that patients and healthcare providers remain vigilant and cautious, fully weighing the potential benefits against the risks before embracing these medications as a quick fix.